Thank you. Okay.
Yeah, perfect.
And your move.
And I'm moving the motion,
thank you
yes.
very much. Yeah.
And the motion calls for the naming of the new National Children's Hospital after Dr Kathleen Lynn. Minister, thank you for coming in to hear this motion and to respond on behalf of government. I do also want to welcome and thank the members and representatives of the 1916 Relatives Association, not just for the work that you have done on this campaign to name the new Children's Hospital after Dr Kathleen Lynn, but also, I suppose, to consistently honour and respect the memories of all those previous generations who fought for Irish independence, fought for our freedom and right to self-determination and for our republic. I'm sure your ancestors are very proud of the work that you do, and we really appreciate it, and thank you for being here today. I want to also, I suppose, when I start to speak to this motion, Dr Kathleen Lynn should not need any introduction. Her name should be one that is familiar to all of us, but that is actually not the case. She is a woman who was a very brave individual, a courageous and ambitious individual, not just for herself, but for our republic. She was a pioneering medical doctor. She was one of the first females in Ireland to qualify as a medical doctor. She was a Republican, a proud and courageous Republican, and she was a champion of social justice. And for all of those things, she was a woman, and she's not actually a dub. She was from the west of Ireland. She was born in 1874 to Catherine Wynne and to Robert Lynn, who was himself a Church of Ireland clergyman. And she did dedicate her life really to others. In 1909, when she was just 25 years of age, she became a Fellow of the Royal College of Surgeons. And she then went on in 1913. She was involved in the lockout, and with Countess Markievicz, she helped those who needed help most. In 1916, she served as the Chief Medical Officer for the Irish Citizen Army. And after the Rising, she spent some time in prison, but after that, she founded St. Ultan's Children's Hospital with Madeleine French-Mullen in 1919. And actually, the 1916 relatives count amongst their members people whose families were cared for in St. Ultan's. And St. Ultan's was a centre of, a pioneering centre for not just children's healthcare, but for women's healthcare. And I suppose at a time when, you know, we were a much poorer country, and where there were very different social and economic challenges, Kathleen Lynn and all those who worked in St. Ultan's put the health and the welfare of children first, their mothers and their families. It was a unique and groundbreaking approach, and for that, St. Ultan's became referred to colloquially, I guess, as a university for mothers. It was actually, not just a pioneer of children and women's healthcare, but also public health. You know, we've all come through the pandemic and the idea of inoculations and vaccines, and they were the first to pioneer the BCG inoculation, which obviously transformed healthcare in our country and ended what had been an almost certain death sentence for anybody who had previously been diagnosed with TB. The new Children's Hospital has been in gestation now for a very long time, but it is reaching an ultimate point of readiness, and we're all looking forward to it. Temple Street is in my own constituency, and there's Crumlin Hospital, and I suppose we're all very eager for the hospital to be a success, and we all wish everyone who works there well. I think everybody has a shared ambition, though, is that the hospital will be a place that the patient will be at the centre and will be the primary impetus for all action and all care that is provided there. And it's for that reason that I really am hoping government will get behind the campaign, which I want to acknowledge has broad support. I am very proud that obviously my own Fianna Fáil party unanimously endorsed this campaign. It has been spearheaded by the 1916 Relatives Association. It has been backed by a number of political parties, and I'm sure the others will speak here today. It has also been backed by SIPTU and FORSA and the National Women's Council. And I want to thank the Joint Oireachtas Committee on Health, which has also endorsed the proposal, and the Oireachtas Women's Caucus. There is very broad support. This is a motion and I suppose a proposal that I believe we can all own and we can all support and we can all champion. And I really believe the reason it's so compelling a proposition is because of her. What she did with her life, with her talents, with her energy, how she applied them for the greater good, and in a way that brought the wealth of her experience and talents to those who needed it most. And I don't think there can be a more fitting inspiration for those who will work in our new children's hospital. It will be state-of-the-art, it will be modern, it will be high-tech, but at its core, it has to also have as its guiding principle the care of the patient, the primacy of the patient's need, and have everything that is done there done for the patient's benefit. So, Minister, I'm sharing my time with Senator Clifford Lee. I want to thank you for being here. I want to thank everybody who engages in this debate, and I really hope government will be able to give a positive response to this motion. Gurmagad.